One of the things that happens during pregnancy is that you lose your hip extension. So that is your body's ability for your leg to come behind your body. So when I do this, you can see that I start to arch my back to get that range of motion. So if I just go to where my hip limits me, it's about right here. And I probably don't even get to neutral. Okay, so what this means is that I have to work extra hard to keep my butt strong during pregnancy. This is really common. This is a big part of why people shouldn't necessarily jump back into running right away out postpartum, because you got to work to get that hip extension back. This is a story for another day. 3 things that you can do to work your hip extension. This is important also because sometimes people attribute having a breech baby to having really tight hip flexors. And so if you want to make sure that you keep everything open, try and get baby in the right position, it's important that you can keep that strength, keep that length of the hip flexor, and you get that by this hip extension. So I hope that all makes sense to you. We're going to do 3 exercises that are going to stretch the same exact muscle. The first one you can do this is just standing. So standing here, you can be here, engage your tummy. You don't have to be pregnant to do these stretches. They're great either way. Keep your toe facing forward, and then you're driving your hips forward and kind of tucking your pelvis under. You should feel a nice big stretch here. To make it a little bit more aggressive, you can gently open up the whole side. You might feel it here and here. It should feel like a good stretch, should not feel painful anywhere. So that's my first stretch for you for that. This is also great if you're having round ligament pain. Okay, so number 2 is the way to do it. You can grab your foot and do a quad stretch, or you can rest your leg on a chair, or you could do it on like the back of a couch if you want more of the quad aspect of your leg. But you can just be here, same thing. Tummy is tight, tucking pelvis forward. I feel a more intense stretch all through here. So that's really nice, has a hip flexor, hip opener, really preparing baby to come into my pelvis, and hopefully with head down the right way. That was number 2. Number 3, same variation. Might be a little bit more challenging if you're pregnant. I show this usually on the table, but of course at home it would be, you would do this on a couch. So a low couch is fine. You would bring your leg onto the table. You're not going to rest your belly on the table, but you can kind of bring it off the table. This leg comes forward. You're getting a double whammy. You're stretching your buttock here and your hamstring attachment to your pelvis. And then you're stretching the front of the thigh that's on the table or on the bed. I'm sorry, on the couch. You can gently press up here and hold it. All of these stretches, I recommend holding for 2 minutes at least. So that's probably longer than you've been instructed to hold a stretch before. A lot of times it's 30 seconds. But to make real change in the muscles that we're trying to make, and to maintain your ability to have that hip extension, we want to hold it for about 2 minutes. You can even go up to 5 minutes with some of these to make really nice, long-lasting changes. Work your way up to that because stretching can make you sore. When you're doing this type of stretching, you have to make sure to keep the transverse abdominis engaged. So that's contracted, those lower abs contracted. They're going to keep your pelvis in a stable position as you go into these stretches. Hope that helps you, and wherever you're at in your journey, pregnant, postpartum, or just life in general, these are awesome stretches no matter where you are. Take care, guys.